blessed and you'll know. You can't be having fun. No talking amongst yourselves, please. I want to talk a moment about membership in this academy. Probably a third of the people here are members, and I want to invite you to be a member of the American Academy of Biological Dentistry. You pay your money for the meetings, and I'm hoping you feel like you got your money's worth for the meetings. Thank you.
How many didn't get their money?
They're all over there cursed, don't you? Yeah, and it's a big plus that the people that sponsored this meeting, the manufacturers over there, and there's so much interest, and that's a plus also.
Everyone there, that's true. There are a lot of people that haven't catch plane flights, so we understand that. But those that are here, we have a
So we need to plan. We've got plans next year, March 5th, 6th, and 7th. Here again. For next year's meeting, we need your input about speakers that might interest you, speakers that you know of that would interest others. We need you to bring a friend. We need you to bring a colleague, bring somebody that needs this information, because we need to increase our support so that we can plan the meeting for next year. And we need you, if you're not currently a member, please fill out a membership form, your credit card information, and before you leave today, join this academy so that we can continue this kind of work. We need you badly because it takes folks, and it's working, and we need to, you can make it work better and better and better. And we're focusing now on 3 years from now on the meeting, and you've heard it mentioned already perhaps that we're talking about having our meeting 3 years from now, our 20-year anniversary of the IABD in Hawaii. Planning a week-long meeting. If we start now, planning it, thinking about it, dedicating time to it when we get further along, closer to it, then we can have a worldwide event. And I would like to have to address that problem.
Well, one of the things we're talking about for this meeting that's why they have Medicine Week in Baden. We're going to call it Medicine Week West. We're going to have them made. So, like I said, we planned this. It would be nice. This will be international in this program. We're talking about that. One person I just said will bring about 200 people from Asia, and then we have some people from Europe that want to come from England. So this could be possibly the international scope of the meeting. So I agree with that. Our next speaker is one of the most energetic and one of the most fun people you ever meet if you meet him. We have nicknamed him Free Radical. Dr. Free Radical. He bounces everywhere and is everywhere. But what's so... What? No comment. No comment. But he's healthy. I'll say that much. Dr. Francis Lai has dedicated his life to probiotic medicine. I don't know if any of you know Dr. Schimmel from Germany, but Dr. Schimmel and I, about 15 years ago, sat on the steps, maybe it was longer than that, on the steps in San Francisco, and we were both lecturing, and we both were sitting there, and we were both comparing what each other had. And he had a probiotic that he said was over $100, and he wouldn't ever travel anywhere in the world without it because he couldn't eat the food and he wouldn't be healthy. And I showed him my probiotic that was about a $125 bottle. We were like two little kids sharing, and then we both agreed that 60% of the immune system is tied into the gastrodigestive bacterial probiotic complex in the gut. 60% of our immunity ties into that factor, and I include also the oral cavity as part of that gut GI complex situation. Dr. Lai actually set up an international organization for probiotic medicine, and he brought speakers in from all over the world. It was an amazing job they did. He put 2 conferences on, and I wanted to invite him here today to share his life and his passion. And I know he's right. I know that all our speakers that spoke are right. And this information, I used to use a special probiotic instead of antibiotics, and it worked. I even went and came back from Hawaii. I'll share this quick story and let Dr. Lai speak. I went to Hawaii to save a friend of mine's life, my girlfriend. Her gastrodigestive system was out, and I actually climbed up to the mountains up in the Big Island of Hawaii and collected cow dung to reimplant into her gut system. I mixed it with narwhal water to reimplant into the gut system to save her life. How would you like to go to Hawaii on a vacation and your significant other tells you that if she doesn't get well on this trip, would you assist her to help her to die? I mean, it was a powerful journey for me. I mean, and it worked. And the idea came from a young man who went to the Big Island and was dying in terminal and ate cow dung. Fresh, organic cow dung with bacteria and soil bacteria in there. And you know something? He recovered. And he got the idea from World War I, soldiers in the North African campaign were dying from dysentery, dying left and right like flies. And someone said, if you eat fresh camel dung, you will live. And the men that did that survived and lived. Another short part I'll share with you is that at one point, UCLA was going to set up a irritable bowel syndrome wing at their hospital there. Then one of the wealthiest men putting money in. And I talked to one of the head administrators of this program. And he said in the old days how they resolved ulcerative colitis, that they collected stool samples from all the medical students and rectally implanted them into the students. And this reversed ulcerative colitis, chronic diarrhea symptoms. So there's a long history of this, but the idea of soil bacteria and probiotic medicine is not looked at by most of the medical profession. So I want to introduce Dr. Lai, and Dr. Lai may take some of his time to let Dr. Ono speak. I heard too. I'm not sure if that's what he agreed. Is that what you want to do? Because the combination of the positive energy water and the appropriate use of probiotic bacteria is a powerful 1-2 punch for you that are trying to reestablish health in your patients. The gut system, remember, 60% of immunity is in those bacteria. And Dr. Ono says bacteria are the part of life that make us what we are. And we don't acknowledge and honor these little wonderful critters that we just take for granted, and we blow them up with what? Antibiotics. Penicillin and the atom bomb were developed at about the same time. One destroys indiscriminately all life, whether military, civilian, good or bad. And the other does the same thing too. Isn't it ironic, the macro-microcosm of life? So Dr. Lai has spent his life, he's a PhD, taught at medical school at North Carolina. Was that North Carolina? North Carolina. And biochemistry. And we call him, like I said, we just coined his nickname, Dr. Free Radical. So here is Dr. Free Radical, Dr. Francis Lai. Let's give him a hand.
Interestingly brought up about the bacteria in the gut. One thing we tend to forget, the 3 to 5, well, we have roughly about, I would say, 5 to 10 pounds of bowel total at any time. And it keep going out, you keep putting in, you eat, and you have bowel movement. But total is about 5 to 10 pounds. And of that is about 3 to 5 pounds, depend. Pure bacterial mass. This pure bacterial mass is a balanced community. this community consists of 400 species and about 100 trillion of total cell number. This number is about almost twice as our body's total body cell. That means we have a foreigner deep in our body twice bigger than us. It sounds scary, but it's true. The point is, they live in our body for life, and we ignore them. Doctors don't even want to look at it, and common people say, talk about that, and every time when I bring it up is when we are eating the dinner. They say, oh, can you talk about that later? That's how much we, in a way, we despise our part of our body, and actually bigger than us, remember. So we must look at it seriously and recognize it in order to become friend at least. Look at it, think about this mess. This guy has been with us in our gut, lower gut, mostly in the colon, for our lifetime. We might as well look at it as part of our body. And in reality, it is responsible for more than 1/3, up to half of the digestive function. It is an indispensable organ. So imagine when people cut their gut out, That's terrible. Anyway, so remember, this is how important it is. It's indispensable. You want to have life, you must have this indispensable organ with you for life. And most importantly, they must be balanced. If they are balanced, there's no pathogen, because even the E. coli, it's when you think about it, you think that's a bad guy. No, it's not. All this help us to digest when it's in balance. Like in our society, as I said, it's a community in our body, so we must look at it very seriously and be fair with them. They are not bad guy at all. When in balance, if we live with them peacefully, they are actually helping us in a lot of things. Now, what happens is when we don't, antibiotics or hormone or steroid or eating a lot of putrefying food, putrefaction promoting food and so forth, and drink a lot of the stuff, then you disturb that community. When you disturb that community, then it starts to putrefy, and fortunately, an eating habit or lifestyle is a long term. And when that happens, when the community disturbed and you lost the majority of the good bacteria, then I will say with a bad word, your health is doomed. And then in many ways, it could come out, you could have psychological problem, or you could have physical problem, or even spiritual disconnection. Many things could happen. So let me finish one more thing before we get into the one in the folder about the tree of modern diseases. I like to say one thing when Dr. Harada said about the what do you say? Cow dung? Cow pie. You sure people understand? But we don't want to say cow shit, but but tell you what, this is what happened in our community. We humans are very funny people, because when we look at something real good, but if it's not come from your mind, you tend to reject it, or tend to undermine, tend to whatever. That's not for me. It's not good. Look at especially our doctor community, our doctor including dentists. Don't forget, dentists are actually doctors practicing oral medicine, right? Mouth medicine. Mouth is the first step, first part of your total health. So we doctors tend to forget things and tend to reject whatever not come from your own mind. So be open-minded. Remember that. So how open? What happened to the? You just mentioned in 1921 to 26. These 5 years in Aero Medical Center, they Dr. Ritter, I think he himself a microbiologist, and then he gang up with so many doctors. Using, at the time is worse than you just said, from cow. They using the healthy persons, they extract from healthy persons, whatever you call it, or sometimes they have a tube go in there and suction out, and then they make it into solution. And somehow they implant into the person with the colitic condition, ulcerated colitic condition, or constipation, or long-term those bowel problem, IBS, irritable bowel syndrome people. And they have from 60 to 87% cure rate, completely reversed. And wrote a book. This book, I found it in University of Utah Medical Center, medical school. This book is, of course, out of print, and you can find only one probably somewhere. This book out in 1926, right? So they start to practice, but in no time after that, disappear, and then it just totally not heard of. Using the lactic acid bacteria, the Lactobacillus acidophilus and so forth, to reverse the bowel problem. So it was done with the healthy human stuff. Now,
They said you can use the word stool, Dr.
stool. Anyway, bring this out from the folder if you can find it. Otherwise, don't worry about it. This outline. This actually, when you go home, you have a chance after you done eating. You have a kind of mood to look at it, and this outline the material I would like to talk about in next 10 years. So, okay, thank you. I hate to hide behind the desk. I want to be able to people to see me. I'm a real person. So this is outline the thing I like to discuss next 10 years. Why? Because we doctors tend to forget ourselves. We doctors must be the healthy one, not just because we want to people look at you and say, oh yeah, you're a healthy guy, I can trust you. No. We do want to live a good life ourselves. That's what Dr. Ono is going to discuss about Shintopia next. Remember that. We doctors deserve because we sincerely helping people. I don't care whether the political people like it or not, or even God like it or not. The God, sometimes he may not like me because I want to help everybody to recover. And he said, well, that bad guy, I don't want him to live for too long. Leave him alone, something like that. But I save everyone, including enemy. That's what in the Bible, by the way. So what we must know is we doctors deserve good life ourselves. So we want to look at the whole thing, the total health. So I think all of us probably know a majority of us get into this holistic health practice is, especially if they're MD doctors, because we try to save our life first, or we saved our life with the holistic natural health program first. Then we say, what happened? I have been preaching. I taught medical school for 10 years, right? What I have been teaching them. Just like Dr. David Green of the Dean of Medical School of Brown University, in the graduating ceremony, he told those guys, say, you think you are going out there to save people's life or help people, but let me tell you, you study everything in this medical school. The problem is, what we have taught you in the last many years, 50% of them are wrong. Wrong stuff. And then they look at him and say, well, but you know what the problem is? We don't know which 50%. All right? So, when I first heard of the Chinese herbal medicine, I'm Chinese, and I heard of the acupuncture when I was teaching medical school. Can you imagine you talk to me about acupuncture or herbal medicine? I might smile. I'm a nice guy, you know. I must smile and say, yeah, oh yeah, sure. But there's no way. Until I was hit so hard by one of the patients, you know, say, Dr. Lai, what you are thinking, da-da-da-da-da-da. I say, oh. So I got into herbal medicine because of that. And I end up getting an acupuncture license in Chinese herbal medicine. And then after that, then he looked at me and said, you know what, with the herbal medicine, whatever we are doing, still not as good. But this guy is an Iranian. And he said, you know, I heard that probiotic something. I said, well, let's try it. And it helped him. Even that, it helped him. Now, go back to the point. Where were we? Today, we don't have much time because it takes 3 whole days to have a International Congress of Probiotic Medicine to finish. So there's no way I can finish everything in such a short talk. And we don't have 3 days here either for me. So what I like to say is, let's get right to the point. I am going to today, this is the first time I talk. So today, I want everybody in this room go home, be able to get total health from probiotic practice and to help your patient. Yes, we have probiotic medicine for many years. And I will talk about how we define the probiotics in biological dentistry later, which is slightly different from the probiotics we are talking about. But anyway, we focus on the probiotic, meaning the bacteria and substances, mostly lactic acid bacteria, and substances we call prebiotics, the feed or the substance to enhance the growth of good bacteria. This probiotic medicine has been many years, and what happened? The research, since it's been suppressed, right? Only in up to 5 years ago, only 26, and I have the record of that, only 26 articles you can find on good bacteria. In the last 5 years, now you look into the internet, you can find thousands of articles, only in the last 5 years, okay? So there's so many research into it, and people jump into it. But remember, in this country, well, any civilized country now, people look for money, right? Okay, don't worry. I'm going to tell you how to practice, and you will not be poor and lonely like me. So you must listen carefully, because I'm tired of being poor and lonely, you know. So tell you what, people are using the wrong stuff. They think, I want to purify, I want to isolate this poor bacteria, and they freeze dry and isolate all the bacteria. You dump the whole can of bacteria. One of my patients actually dumped the whole bottle, and then he following day he told me, I said, oh, but I didn't know yet that time. I said, well, I'm okay, don't worry. The whole bottle. Why? Because how would you like to be put in the freezer for a couple, whatever, not to mention to dry you up? These people, they freeze dry the bacteria and isolate them and then become a powder and give it to you, say, we have 10 billion program in here. You try to culture it, you say, God, looks like a dead, you know. Well, you can revive after several culture and culture again and culture again. Maybe eventually, ooh, here I am, you know. Maybe a couple of them didn't die. But so think about it. We don't like to be frozen. So is our little friend. Oh, I should with this finger because this the wrong finger. So our little friend, they don't like to be frozen, too cold, right? And dried, not to mention dried. So this is what I have discovered. I try to help people, try many things, try many ways, use whatever. So many, use different blend and combined. And sometimes I tell them, like I said later, I practice by one big bottle from Natural. Those people, they claim they have a strong bacteria, and then how concentrated, right? But what happened? No, not too good and too slow, and people don't have patience, you know. So I end up thinking, culture my own. And then initially culture because I used to be against the milk. So culture in this sourdough base, sourdough starter, and you can cook it. So you have to drink the sourdough liquid straight. The first time when I drink it, I almost threw up myself. But I was with the people there. I had to be brave, you know. So I just I hold myself so strong because with my martial art training, you know, I hold it. But I tell when some patients say, "Oh, I can't drink that," I say, what a wimpy! You can't be wimpy. Remember, you have to have gut. You have to be strong. Remember, Americans say, "No guts, no glory." Come on. And later, huh? Oh, hey, next time I'm going to do that. Yeah, but what happened is, and later I said, well, I'm going to give a little treat. And I put some FOS, which is a little bit sweet, in there. And whatever, I try. But after they get used to the bad taste, and they begin to drink and they get well. Then I tell them the truth. They say, I thought you like it. I say, are you kidding? Are you kidding? So, but now I found out, if you want to use the starter to culture your own probiotics, you just have to, you need to use you can use whole milk even, if it's organic though. You can use the whole milk. The reason being this. Remember, you are using the milk to feed the little guy. You are feeding the little guy with the whole milk. Whole milk actually very nutritious. It's just not fit for us to consume because it has 3 times more protein, and it could hold up your protein concentration, and it's mucogenic. And many people are allergic to the lactose in reality. Now remember, when you are using the culture, the milk, you are using the most complete nutrition to feed those little guys. And they eat it, and so you, in reality, if you culture to complete cure, you don't have much milk left anyway. You know what I mean? You don't have. So don't worry about it. Or you can mix it like 10 to 20% to culture it. But read the program, read the whole thing. And if you are sincere, want to really get into a practical program to reverse your total health. At medical school, and I was practicing something, during the, I have the clinical license in physiology. So during that time, I almost died myself because of, you know how we eat at the hospital. Hospital food is the worst because they have to make money out of you, you know, in many ways. And they have to make you sick so every department can work on you. So anyway, anyone goes through internship in hospital, eat the hospital food, and so forth, they need probiotic badly. And then remember, last thing, before Dr. Ono speak, people think you need water, water, water. But if water is the most important thing in our life, of course, you got to drink good water, okay? I'm going to let Dr. Ono talk about, they already talked about that yesterday. So you need good water, need medium in there, so those little guys will appreciate. So don't put junk in there. If you drink coffee, you better drink 1 bottle of the no real water following your coffee. That's the honest recommendation. Anyway, so any question, remember, I'm just outlining for next 10 years talk.
I just want to add,
Yeah.
in your culture, do you use kefir?
Yeah, regular kefir, you can get into internet and get a kefir starter. But don't buy the one you just keep buying from them. Because they want to make money. You buy one, tell you that you can use it for life. That's the one you buy. It's a bit more expensive, but worth it, okay? Now, so any question, I have the email and, well, we have the list, mailing list from here anyway. I am very generous, very open. Ask any question. If I don't know, I tell you I don't know, but very rarely I say I don't know. Yes?
What do you think of this Garden of Life primal defense bacteria?
Oh yes, Jordan Lubin. Actually, his philosophy is very close to mine. And that's why if you are too lazy to make kefir life culture yourself, you can buy, if it's well formulated. And best complete probiotics now is come from Jordan Lubin or from me. My product will be out in 2 months. And I'll send everyone the what it is and tell you why it's the best.
I'd say another thing.
Yeah.
You were talking about whole milk,
Yeah.
and a lot of people are resisting because of the allergic.
Right, allergic to it. But
But you take raw milk.
yeah.
There's a few left in this country, or talk about raw butter,
Mm-hmm.
are actually probiotic. They really aren't what
Yes.
we consider dangerous.
Uh-huh.
So I just want to mention that the misconception people have.
Yes,
about
yes,
dairy
yes, yes, yes. I know.
applies to pasteurized, chemically, hormonally induced.
I know that. I know that. Just remember, if you culture the live one, the active culture, it will destroy everything you put into there, all the junk. So do not worry about it, because I have experienced this for quite a while. And I am a living example. I almost died. Literally, I almost died. My daughter was so scared. When she was little, I picked her up from the kinder care or whatever. The moment we got home, she started to cry. She said, because so pain. She said, I thought back there, I was teaching medical school at that time. Back there, I thought my dad was dying. So, and she remembered that. She's now 31. I'm 64. So, you can, and remember, Dr. Ono, get ready. Remember, with probiotic medicine, with good water, with the good medicine we have, 80 is middle age. We're supposed to live to 160 and still jumping around. Okay? Yeah. You want this or you want this? How to do this? Oh, just take it off. Oh, yeah, okay.
Thanks.
Put that in here and then put it there.
Okay.
All right.
Okay, thanks.
Where do you get the pink sheets?
This different color, that's all, but the same thing. Same thing with in the photo.
Uh-oh.
Oh, I got it. Thank you.
Yeah, everything the same.
I, okay. Okay. Okay.
Oh, you can, if you
Yeah, that's fine. Okay.
this one,
Uh-huh.
then we'll take that off.
Okay.
Yeah.
It's okay. Okay.
So don't
Okay.
yeah, come here. Okay, go ahead.
Okay. Before I will tell my vision, I will tell something. Right now, Dr. Lai told how important the bacteria. How many people can drink mold coffee? Mold coffee live 1 month. Mold is growing. Okay? Okay? Let's say how many people can drink mold coffee? How many people will drink the mold coffee? Please raise your hand. Wow. Nothing. But I can drink. Why? Because of, what did you say? No, because of this Nariwa water can give the electron to the mold. Even though E. coli, even though typhus, even though any kind of the bacteria, okay? Bacteria right now, why they will attack us is they are free radical, okay? So that they will attack our body to get the electron to make stable. And if this water can give the electron, and not only myself, my staff already drink mold coffee. Nothing happened. No vomiting, no nausea, no diarrhea, nothing. And immunization is so up. Wow, it seems a so nice bowel movement tomorrow morning. Because of this water can give the electron and one and stable and have a good feces and something. I got this water, but when I come over to US, there are so many patients around. I never seen such a patient in Japan. Why are you so many patients do you have? Why are you? Because of you ate the chemical food every day. But just look yourself, think yourself. Japan is the healthiest country in the world. Why Japanese is so healthy? Because of they ate the fermented food. Fermented food is miso, natto, or sake, soy, soy sauce. Tempeh. Oh, and the miso, natto, sake, wine. No. And the mincing it. Because of Japanese always eat the fermented food. What do you mean the fermented food? Is because Japan is a very small country. America is a very big country. So that if they destroy the food, something, the crop, something, you will go to another state. If this place, or go to another state. But Japan is a so small country. Okay, around the ocean, nowhere they can go. How to keep the food? And even though Dr. Pasteur made the pasteurization, what do you mean the pasteurization? Tell me. What do you mean the pasteurization? Yeah. That's meaning the temperature up and the dramatically temperature down and kill. That is your mind. But Japanese is completely different. How to make a good relationship with bacteria. If we can make a good bacteria, they will make a good feces, as well as they can make a good urination or everything. And when I graduated medical school and I come over here, there are so many heavy metal patients, but right now, Japan never has a heavy metal disease. You are so many heavy metal disease and MS, Alzheimer, cancer. Because you don't know how important the fermentation. Meaning is, Japanese always respects the nature. Nature is a mountain. Okay, lots of the mountain, rainfall. And that's gradually fall, and during something, water got a mineral. And finally, to the river. And they will drink that is a mineral water. Okay. However, if chop the tree, acid rain fall direct to the river. And we are drinking the acid water every day. And as well as chlorine is completely wrong. Chlorine, because just remind yourself, the Nazi, what kind of the thing to kill the Jew? What? Chlorine gas. Chlorine gas. Okay. Chlorine is easy to melt in the water. And you are drinking the chlorine gas water every day, every day, every day, every day. Because of, you think, we should kill the germ. We should kill the germ. We should kill the germ. Germ is a killer. Germ is a killer. Germ is a killer. And I think if we will use this Nariwa water put in the toothpaste, okay? No plaque, no gingivitis, I don't know how to say many things, no inflammation, nothing. Dentist told me, I'm so excited. Nothing happened because of this water can give the electron. And this is the germ, not something, the germ is so happy. And to make immunization. And as well as this water can give the good electron to the intestinal flora. Right now, why are you so many breast cancer? Because of for always the colon and the liver, okay, liver, colon, always circulate. And during that colon, the intestinal flora can always purify the blood and purify blood to the liver. Liver detoxify and be back. And during your menstruation, this contaminated blood as a menstruation as a flush out. But after menopause, why you suffer from so many breast cancer? Because of cannot flush out the menstruation or the waste product. Finally, this as well as you always ate the chemical food, intestinal flora lose the power to purify the blood. This impure blood go to the liver, but liver cannot make a detoxification. And finally go to the breast. Okay, and breast, that's nipple. and breast. Gradually build up the waste product and made up the calcification. And if you suffer from that mammography or something is, that's the, and what I want to say is, right now, we think ourselves, how important the appreciate, gratitude, humble to the nature. Nature made everything. Human being destroyed everything. Nature made the perfect because of 15, we always receive the invisible energy from universe. From 15 billion years ago, Big Bang. 4 billion years ago, our solar system made. 3.5 billion years ago, our original living things is born in the water. And right now, we are, and that is only single cell, but right now a multiple cell. And everybody think, if we have a technology, we can go to the Mars, we can go to the moon. That is completely wrong, because of we always receive the invisible energy to the brain and to the because of the hemoglobin. Blood is hemoglobin. Hemoglobin. Hemo is iron. I always get the hemoglobin, and so that we can alive right now, whatever we want. But if we go to the space, we never get the magnetization. And many spacemen went to the space. But if come back to the Earth, they, one step, fracture the bone. No more walk again. We are very luckiest person. Right now, we have a life is, we always receive the energy from universe. And Earth is a very special planet because core of the Earth is iron, nickel, cobalt. That will get the magnetization. And we always receive the energy. So, because of, I got this water is, this water is very special is, 1 billion years ago, sea volcano eruption, meteorite hit, and made this mountain. Limestone, granite, magnetite, and the something, and the 74 mineral, finally, strong magnetization. And this water is a natural magnetized water. I found that this water, because of I am a 61 generation of my family. Almost a Mongolian invade to Japan. Right now, 61 we are. And I got this water. And I'd like to share this water, as well as I got my vision. That is Shintopia. Shin is a Japanese philosophy to respect the nature. And utopia, Shintopia. And I made the Ono Institute, that is non-profit organization. And I would like to make a Shintopia healing center. And people come over to heal. As well as I'd like to make a Shintopia foundation. And this one is, next step is Shintopia University. Because of the education curriculum is so important. And next step is Water United Nation. Finally, that is save our planet. That is a big picture. But without this big picture, we will ruin because of the chemical. Right now, every lady's egg is already chemical. Because of the right now egg is chemical. Normally, egg is lady's egg is prevent the even though sperma something come over, but chemical sperma, but they rejected. But egg is already contaminated, and this one is come inside and fertilized. Right now, autism, because right now in LA, 1 out of the 10 children is autism children. There are so many autism children, and I finally think so, and many children, because of we should stop their crisis. And I hope everybody, I hope you understand how important this vision to protect our environment, as well as we should keep our ideal planet for next generation. Because of if we destroy our Earth, next generation will cry or something cry or some agony something. And I think I don't know how many people understand my vision, but right now we are same boat. Our boat is already the Titanic. We are thinking that that is in the ocean. Because of our boat is already big hole. If somebody will stop the hole, we will ruin. And I hope everybody understand this vision, and as well as many people who would like to join this vision and to give the hope for next generation. Thank you very much.
I just got a confirmation from Dr. Annie Landerman on the Naria water. They went out and drinking a wine the other night, and he just told me right now, he says, I think the Academy should sponsor this and do a program where all of us in part of the process come to the Academy, because he said it works. He said he did not get any after effects from the wine that they drank the other night. It does antidote toxins. So what we're going to do right now is we're going to take a little break, and we're going to come in and have a panel. We're going to get all the speakers of the panels up here, and then you can take the time to go and ask questions that you want. We're going to try to go get and tell all the panel speakers please to come in here. We'll put them up, and we'll take a 10-minute break right now. Come back, and we'll go ahead and have our panel discussion.
That's how you can create a structure, I see. I don't know any.
Dietrich got a reply on that. Your ankle?
Yeah, my ankle's much better. Yeah. Right.
Okay. Anyone have any comments on anything else? But one of the ideas of this organization is to also have the practitioners heal themselves here. So maybe that avail yourself of the different therapies and evaluations and whatnot is one or two, because you have to take care of yourself first before you take care of your patients. We are caretakers and caregivers. Again, not like Dietrich running all over the world, trying to all over the country trying to heal and teach and put people together. And I know Jerry's doing the same thing, and all the speakers probably do. So, okay, then we're gonna have a panel discussion around this. Is one of our classic parts that we have. Be questions and answers for all our panel members here that have remained and not haven't taken place. So anyone have any questions? We have Dr. Chuck Yokoyama, we have Howard Remnick, we have Dr. Ona, we have Dr. Lai, we have Jerry Tennant, who else is out here? Everyone knows Dietrich, Dr. Bob Jones.
Right here.
Bob Jones, you gotta come up here. You're on the panel.
You got the honors.
Okay, I can do that. Bob, can I just make a real quick?
I think I told everybody all I knew yesterday.
Well, they might have questions. Bill Glaros, who is our president, had to take off because he has a plane flight, so he says to give you the best of wishes and wish you all the best luck and great luck for progress next year. Yes, go ahead.
Yeah, one of my questions about Bob Jones is just here because one of my questions is, okay, when it comes to cavitations, we've heard some talk about incavitations using various techniques, and we've also heard, or talking to some of the dentists here, I've been hearing about the importance of digging them out as well. And I'd like to hear what you think, Hannah, about the possibility of healing cavitations.
Okay, I'd like to address that under the auspices of what we did with the FDA on our FDA clearance to market the medical device. And what they asked us to do during the process of going through all the FDA determinations, they asked us to write a level directory on the types of cavitations. In other words, it's a level 0 through 4, 4 being the worst. It's like all other diseases where they say a tumor size or whatever, or lesions. They have the same type of documentation. And they asked us to do that, so we went back through with the doctors involved in the research study, and we came up with an image level up through 0 being normal cancellous bone, 1 being slightly ischemic, 2 being extremely ischemic but not quite into what we call cavitational osteonecrosis, and no holes there. And then 3 and 4 with holes in the bone where it was showing up with reds and the light oranges, transparent oranges. They approved that. Now, what they directed was that since this was a necrotic area, void of blood, and it was essentially dead and very dead, necrotic, that they required surgery to alleviate levels 3 and 4. Levels 1 and 2 could be treated with some type of blood stimulation type devices or medicaments. And then if a 2, though, was adjacent to a 3 or a 4, that they should be surgerized and cleaned out by surgery, and then the bone will heal normally if all the necrosis is removed. Because what happens is these things are so toxic that the toxins inside the levels 3 and 4 are so toxic that they stop the osteoblast to osteoclast conversion. And so you do not get healing. I mean, you go in and you clean it out, you can't heal it if you leave any necrosis in there. So they say take it all out. And the FDA's approved that. That's in their deal on the cavitat approval. And so we're the only system that's ever been approved for imaging the video process. And that's what we're looking at. And that's what you have to do. And that's the reason it's so deal. I'm not going to tell you that you can't heal a level 1 and 2. You can. You can heal them with infrared, you can do it with stimulus, or you can do it with blood thinners if you want to go that route, or you can use it, stuff like this, but something to stimulate there. But beyond the 2, where you have gotten necrosis, and you have got a probably non-superlative infection like osteomyelitis, you cannot heal that with any injection, with anything else. The only thing that will heal it. Now, you can knock down the toxicants and the degree of toxins with injection, but it will never heal the area, and it will always revert back. Does that answer your question?
Yeah, any comments from any of the other members?
Okay.
Thank you.
Yes. It's posted on the FDA's website under Cavitat. You have to go into the files. I mean, they got the full Cavitat approval, and then they got the levels that are registered. Okay, and what they say curative is required for surgical removal of the necrotic bone. That states that. Okay.
I'd like to just, also a belief system that makes it possible. It seems to be in the last 2 or 3 years, I've seen an acceleration of cases of dramatic healing of the jawbone with conventional methods. You know, so this is the people that are on the edge of the Gauss curve. They're not as frequent and not as common. And so in general, you know, I would personally back up totally what Bob says. And yet, this group here are the miracle workers. I mean, let's face it, you know, there isn't too many people out there even that know that there's an issue. When Anne and I started 10 or 15 years ago, there wasn't a single psychic in the world who was ever picking up a cavitation, even though the cavitations are as old as humankind. You know, but there wasn't a single psychic. Now suddenly the psychics are there and kind of finding them, but it was us first finding it. Yeah, and then when a certain number of us looked at it, suddenly they picked it psychically up. And the same with the healers. There weren't any healers addressing the issue because they didn't know it was an issue. Now that the issue is out, there's going to be more and more people pooling their healing power and their intelligence together and creating solutions. And so it's very clear to me that we're going to see more and more single cases at first, and then larger groups, and then big groups of people healing from these even at higher levels. Yeah, but currently, Bob is our middle of the road, common sense guy that we need very badly.
Can I add one more statement to that? Disturbingly, and they've been notified, some of our Cavitat owners, we've got about 57 out there now, you know, spread out over the country pretty well. We've got some cities that have got an abundance of them, other cities don't have too many. We're in 40 of the 50 states now, and in Canada, we're covered pretty much in all the provinces in Canada now, or at least one unit. Now and we've got them in Europe and in New Zealand, Australia, and we got some probably going to Hong Kong and South Korea over the next couple of weeks. And so we're starting to spread out. Germany is our big market over there, but I want to caution everyone that does infrared or does stimulus treatment on the cavitation. I believe in all of it. Don't get me wrong. Don't ever say I said that's not good. I believe in all of it. But if you do stimulus on a cavitation, whether it's electronic, or whether it's injected, or whether it's infrareds, some type of healing, you know, that you're doing to stimulate the blood circulation, get them going, and then you run a Cavitat scan, you will get a false negative. And that's one of the only faults that we may have, and it's not our fault. What happens is we can actually measure, by looking at that false negative, we can tell you whether you've stimulated the blood flow or not. And it's actually very good there. Andy, you know what I'm talking about. If you do a cavitation, a scan, and one that's before, and you see the reds and the oranges and the peaks are gone, and you've got a hole in there, and then you come along and you run, and immediately after they run an infrared, if you take another scan, it'll be a negative. It won't show anything. It'll be a green box filled in. And let me tell you why. I liken it to putting a pencil or a round device underneath a running faucet. The sound waves or the water goes around the pencil and exits on the other side of the same cone or the same cylinder volume that it did coming in there. It just goes around it. And what happens when you stimulate the blood flow in the cortical plate and the gum area, the sound waves follow the path of least resistance around the hole in the bone. And I've had some of the doctors that own the Cavitat, and I've cautioned them that they're legally, ethically not doing the right thing by telling their patients, oh, we got that healed without surgery. That doesn't work. What happens is, 72 hours later, you're starting to see the necrosis image creeping back in. About 5 days down the road, you've got the thing back just like it was. You're not healed. What you've done is you've tricked the instrument to giving you a false negative.
So if people wait 5 days, then...
Yeah, it comes back. If you don't do any more during that time, yeah.
Your recommended time is 5 days.
Yeah.
You would feel comfortable with that if
yeah.
the results were not
right.
negative.
But don't get me wrong. I like to see that green that you're seeing there, because that means you've stimulated the blood flow around that area. I mean, anytime you can stimulate the blood flow, you are helping the patient.
Let me ask a question.
Sure.
The same must be true then, that there should be methods that create a situation where you get false positives.
No, we can't get a false positive unless you've got an air bubble. The false positives don't occur. You can get false negatives. The operator cannot create a false positive if you've got gel or connected and there's no air bubbles in any of the system. You can get it. We've got the instrument set at 6 decibels. If you don't get a signal above 6 decibels, which you run into on the upper molars, where you've got a high cheekbone lady or man, and you've got an air pocket between the bone and the gum of the maxilla. And what happens is you have to go in there and inject a gel in there to fill that void to where you've got continuous sound waves going through. Now you can pull a false positive that way. That's the only way, without putting a gel in there. But it shouldn't happen because we've got the white bottom that you see on our instrument set at 6 decibels. When we first put the original units out, that wasn't there. And we started getting so many people saying, well, you got cavitations there when he wasn't there. Reading a false positive, before we went to the FDA, we put that in there. And we have not had a recorded instance where we have generated a false positive since then. And we've done probably 80,000 scans now. That's a lot. And we just don't see it. And so you can't generate a false positive unless you have an air bubble. Yes, please.
Well, this seems to bring up the major difference between a scan for blood flow,
Right?
and regulation rigidity using EAV testing according to Dr. Cromer.
Right.
Because in that system, we look to see what a regulatory challenge does, and then what level of all these various toxic proteins exist, how bad they are, and then once the cavitation surgery is done, we can't even go back and remeasure for about a year because it's going to take that long after your injections and the reknitting of the bone.
Yeah, we can do it at 6 weeks and 3 months. I had a bunch of before and after pictures on my stand out there. If you look at them at 3 months post-operative, these were all furnished to me by Dr. Wes Shanklin, who is a very fine surgeon up in Columbus, Ohio. And we looked at on these studies at 3 months and 6 months post-operative. We also looked at some of Andy's stuff that he sent us on 6 weeks, I think it was, Andy, wasn't it? 6 weeks?
My point is regulation of rigidity is different than blood flow. Blood flow is a part
Yeah, but we don't show blood flow. We just show by the way that the change is that you are stimulating the blood flow in the cortical plate and the gum around it. Now, I can't differentiate between the two. We're primarily a heart tissue imaging system. We don't image soft tissue.
I'm saying that cavitation and the specificity of cavitation, and as that relates to the whole body, is a larger phenomenon.
Oh, it's huge.
It's regulation, rigidity,
it's huge.
And the transit mesenchyme.
Right, it's huge. It's huge. And what I was saying about the toxins, how they affect our base DNA and the chromosome area on these proteins, it's huge. I mean, that whole picture is starting to open up now. We're starting to get a really good picture of what's really going on. And I'm happy to be part of it. I'm happy you guys are part of it. You know, and you're a good audience because you listen and you understand. You ask good questions. So sometimes we can't answer the questions, but that's what we strive for. Science.
I'm just saying that I think it's, in terms of the whole body health, it's a larger picture than the scan can really.
I agree, but all I'm saying is that at that location on the same bone area, okay, that if we show green after stimulation, you've stimulated the blood. Now, if you go in and inject a Sanum treatment in there, it'll do the same thing because the sound waves pass through the liquid of the bone. You know what I'm talking about? It'll show green. There's nothing to slow it down. It's just like if you take a transducer and put it in water, it'll transduce all the way around the world if you put it in the ocean, you know. And so it's just how long it takes to get there, starting what speed you're doing. We're at 1,042 feet per second, so that's what we're traveling at on our sound wave. And so it'll go forever. It'll just keep going and going and going. And in water, it goes 100%. And so if you inject a treatment in there and then you take a cavitat scan, it's going to give you a false negative.
But if we want to prove miracles, then we do the herbs, we do the infrared on the 3-4, and if we do it a week after and it shows progress, that has proven it?
Let me say something to this.
Yes.
To heal a cavitation without surgery, still, at least in my current belief system, takes 6 months to a year.
That's right.
So the time when you want to repeat your scan is not after you do a procedure, it's a year later.
Right.
And that's when you look. Yeah, so there's some misunderstanding here about the timing. I mean, I want to be very clear and realistic
Yeah,
with
you
that.
understood something different than I did
Yeah.
on it, so that's
Yeah,
right.
no,
No,
we
you're
never
100% right.
believed that one injection or
Right.
using an aniline remedy will cure cavitation. It's a process with a synergistic program where you do psychotherapy, you address geopathic stress, you increase the blood flow, you do neurotherapy, you detox the area of heavy metals, you initiate all kinds of healing cascades. And then, when you're at the end of that, then you do the scan again. And there we've seen a lot of miracles and increasing numbers, so it's a process. It's not a one-time.
Yeah, it's a long-term treatment to
The beauty of Bob's technology is that prior to Bob's technology, we had only electroacupuncture or muscle testing to verify there's a cavitation. And the only way you can really verify the cavitation is go in there surgically and open it up, and then you actually drop into the hole and you know it's there. So Bob's technology is to us cutting technology to finally validate, and from also what I call a mainstream approach, get into the system and say this condition does exist and we have a justification for doing surgery. I mean,
And the FDA admits they do exist now.
well,
So,
I
you know.
mean, one of our pioneers, Dr. Andy Lamberman, had to fight this issue before the dental board, you know, in terms of doing surgeries and cavitation approaches. Now, you have a unit in your office now? Because now he can show and prove, and before and after, he can actually validate that there is a problem there. So this is how progress is made, that each step, when Dr. Cromer came in 1986, he showed us that he could prove that there are problems, and like you said, regulatory problems based on a blockage energy flow that reflect to a cavitation. So now, historically, we've moved to the point now where we can actually scientifically validate it. And that gives also the dentists out there the ability to do these procedures with a little bit more, how should I say, scientific validity and credibility. And now you said they do admit that cavitations do exist.
They do
And
admit
exist,
it,
like
and that's the
Dietrich
reason they
said-
say the surgery surgery is approved on 3s and 4 levels.
Right. And like
That's right.
Dietrich said, cavitation existed since the beginning of time because they've probably seen it in the
Right.
mummy bones and different things like this with x-rays. So it's not anything new, but now we have the science to validate. It's like Jerry's, the technology with the scanner. Now we have technology to do some things that we couldn't do before with all these cranial and adjustments and atlas axis adjustments. I mean, this is the evolution of actually knowledge and learning. Any other questions? We have other speakers here too. Yes?
I just think it's important for the dentist to, at least it seems to be for the dentist in my area, to know.
What area are you from?
Seattle.
Okay.
To have an opportunity to know whether or not, you know, without waiting a year, whether or not they got most of the necrosis out, all of the necrosis out, whether they're going to have to, you know, look at going back in there, seeing kind of what's happening in the healing process. So
Go ahead.
my question to you then, I understand that they don't fully heal, the bone doesn't regrow, you know, we need to look at those things after a year, I understand all of that.
Well, even after about 6 weeks, if you're not getting on the cavitate scan, going back into 6 weeks, you start seeing a light green build up there, which means that you're getting the osteoblast to osteoclast conversion, and blood flow is starting to flow back in. And that's the reason it's important to do it at that time, because you'll get some spots that won't heal. I mean, there'll be in that cube. You got to remember, this cube is only 9 millimeters by 9 millimeters by 13 millimeters, and if that's a real small area, right, to be your process of the tooth. And if you're getting a healing, it'll be there. If you're not, in some of those scans we got up there on 3 months post, it's the areas there that aren't healing because the necrosis wasn't removed. I happen to know that this particular surgeon did not take the cavitate scan after the surgery. I like to see it used post-closing or prior to closing. And that way, if there's any necrosis there, it shows up in little orange squares that are transparent, and you can go back in and take another 0.5 millimeter bone out in that area, and it goes away. And when those happen, usually at 6 weeks, you've got solid green. I mean, the osteoblasts have changed and converted to osteoclasts so well that the blood supply has started back in the area, and it's starting to mend, and that patient gets well. There's a tremendous amount of healing has been shown with this. And it's interesting because Dr. Shanklin says in his talks, and he talks at all of our conferences, that he had a healing process of about 60% of remission rates in cavitational osteonecrosis and NICO, which is painful. And when he changed and started using the Cavitat, his deal's gone now between 94 and 96% on first-time surgery.
Bob, I'd like to add to this because what she's saying, I know what she's saying, and what we have here is that at one point, if you take an EAV system like Vol or Cromer or Thompson or anything, you can measure if the infection or what you call the jaw osteitis is there or not there. You can see the energy open up and balance, and what you have is you have an energetic matrix for healing. You can muscle test and see that the energy is open. Dietrich can do this, but it takes time for everything to fill in, but you have to have the energy field open or balanced in order for you to have the right energetic environment to be able to redeposit, bring in the trabecular bone, bring in the vascularity, bring in the energy. You have to have the energy. Energy precedes physical. So you can measure this if you want to know with energetic techniques like that have come before us to see if the bone is clean or not. Like what Bob was saying too, is most of the men don't have the capacity or the skills to determine if they've gotten all the cavitational material out.
Right.
So
you're blind in there anyway. So
unless you have some form of EAV, biofeedback, muscle testing, dowsing skills to be able to determine after you've done the surgery that you've cleaned out. And it's not just after the surgery. Then the healing process of 10 days after that or 2 weeks has. If you don't keep the energy open like Cromer would do every day, would give homeopathics for 10 days following every day, to keep that energy open, you'll get a reinfection of the area.
Right.
Or if the organ system is real weak in that organ system, you haven't built that person up.
Let me maybe say something. Our experience in Seattle is unfortunately not the experience of the 96%. You know, when we send people to cavitation surgery, we're glad if you get 50%, that half the cavitations that are operated are done and over with, and a year later they're still good, and 2 years later they're good. We get about 50%. And we know it is very surgeon dependent. It is to the dentist here. You know, this is a technique that depends on the skill of the practitioner. It is the most skill dependent issue that we have probably in all of medicine. Anybody can operate a brain. I promise you, most of you I could train in a week, and you would do pretty good job in brain surgery. But the same isn't true for cavitation surgery. It's difficult. The room is very narrow that you operate in.
And even the best leave 30% a lot.
And I want to put that number, you know, our number is about 50%. We did long-term follow-up on people. And this includes people sending them to the best, sending them to Chris Husser, who is still considered probably, you know, one of the 3 or 4 best. And when we put that number next to the number that we have with conservative approaches, the difference isn't that huge. Conservative approaches lag behind. That is clear. But there is some real successes there, and there's some real failures here. So we're in a field that is still moving. And the wonderful thing about Bob's instrument is now we got some objective numbers that we can look at.
And don't forget the patient too. There was one situation, the Germans said they cavitated a site 22 times.
Yeah.
That was because the patient energies were so low that they could not heal effectively. So don't.
There never should have been a surgery.
Exactly.
So preparation. If they're well prepared, you're going to get 90%.
I was going to say.
So don't forget the patient's energy.
Yeah.
Just a surgeon. I mean, Chris Susker could be the best surgeon in the world, but the patient's energy is down here, and he's up here, and he does the best technical surgery, and she can't have the energy to do that. So the patient is a key critical element in what their energy levels are too. So it's
do your BTA and do your computerized regulation thermography.
Let me throw something in here.
Hang on, let me say something, because I need to counter this. The 22 times surgery, there was a study by Downderer. The reason this relapses surgery was the heavy metals. I want to bring that issue back in.
Right.
The reason that the thing didn't heal because the moment you have a healing site, the body uses that as a channel to funnel out all the toxins, and the infections show up there and everything shows up there, and the whole dirt in the organism suddenly concentrates in that area. And so that brings that issue in, you know, when to do the surgery. Should you first clean up the body of heavy metals? My answer is a resounding yes, you know, as much as you can. Right. Should you first treat Lyme disease, get the critters out of there that are going to immediately reinfect the area? Absolutely yes. Chris Husser is big on that. I'm big on the heavy metals. The truth must be both together at least. So
as soon as that blood flow starts back in that area, you are increasing the susceptibility to more bacteria flowing into the area and then feeding off of the new blood. And this is a real problem that you've got to address. And because you got good blood flow and the oiliness is surface on the deal has stopped flowing, you know, that oil that you see on this thing, which is a fatty part of this thing, starts flowing out, doesn't mean that you got all the necrosis. And that's what you got to remember, because if you get down in like a half millimeter necrotic bone, that blood flow will flow through that necrosis because it's all spongy, like a sponge or like a coral. I like to liken it to coral. We're looking at bone samples. I've done probably 180 cadaver samples, you know, and we look at what's in there, and it's pretty phenomenal, you know, how porous that bone is.
Well, let me get some questions here. Andy, you had your hand up first.
I just wanted to say that, you know, this is a systemic problem. It has to be treated systemically. This is a local phenomenon that occurs because of systemic problems. And you have to treat the whole body. You can't shirk away from the other contributing factors, the biggest factors being the liver, because it has to do with circulation, and the kidneys, which has to do with bones. And if you ignore those organs, then you're going to have failures, a much higher failure rate than if you take those into consideration. And as well as the organs that are in line energetically with those cavitations.
Yeah, you got a lot of processes there. How many of you use Genovations on your patients? Genovations as a test. Anybody know what it is, or would you like me to explain it right quick? Because it's very valuable.
Yeah.
Okay, there's a Great Smoky's Lab. A lot of you use them for toxicology deals. They have came out with 5 genomic tests that you can run on your patient, where you get an individualized toxicology and inflammatory responses and everything, along with their basic DNA, where you know how each patient should be treated. And this is very valuable when you've got a patient that's too sick to have surgery and should not have surgery at the time that is done. And what they are is they got a panel that they run on osteo, you got a panel they run on cardiology or cardio, munio, and toxico. And they've got a 5th one right now that they're still working on, because I'm working with them on some of the stuff I'm doing on proteins, where we're looking at the protein. And they can give you a basic, very thorough workup on your patient. It comes in 4 spiral wound booklets, and it tells you exactly what's going on in their system, like the inflammatory processes, MTHFR, all the clotting factors, all the APEOE proteins, where they've got the APEO4, which is the most dangerous and most susceptible to these dental toxins. It tells you what that patient's got, where you're not flying blind. I know EAV gives you a lot of deals, but it doesn't give you the basic information we've got there. And then you can tailor a package for that individual and make this thing work. And really, it's just, if you go out and you run a hematology panel for clotting factors, and Heminex, I think, is one of the labs that runs that, and they charge $850 to run just the clotting factors, the 5 clotting factors, and they leave off MTHFR 90% of the time, which is probably responsible for 85% of the infarctions. And then, if you run this deal with Genovations, I have no interest in the company, okay, so deal, but it is a valuable tool because each individual is different. And this portrays to you exactly what you've got to do. Not only do they come out and tell you in the workup on the patient what you should do pharmaceutically to treat that patient, they also tell you what you should do with herbal type deal to bring that patient in, like CoQ10s and all the other stuff. They tell you how to treat each one of these conditions. Then when you get the amino acids and everything balanced back out, now's the time to do the surgery the patient can handle. You agree with me with that, Dietrich?
Yeah. We've been disappointed with the test personally.
Have you?
Sort of like we've used it and put people on the programs and didn't see any change, but other people have. So I think it's still.
Yeah, I've seen excellent results on me personally too, my wife and everybody else. You know, it's really paid off.
I think it's something everybody should do, but not as the only thing. I think it should be one of the tools. You know.
One of our members here has to take off, sir. Is there any questions that you have for Teresa Dale, right, or Dr. Teresa Dale? Does anyone have any questions on her?
Yes, I'd like to have her briefly go over the salivary test, time it takes as far as getting back with the doctor and costs.
Okay, that's a good question.
And the lab?
Okay,
that you use?
the lab that I use is a non-commercial lab in Santa Monica that works with hospitals and they don't advertise. And I invented this saliva test and have an agreement with them that they run this just for me. It takes, from the time the patient gets it to the lab, it takes 10 days for it to get back to the doctor, and that includes my writing a program for you. I have 2 tests, a basic test and a pro test. The basic test has 6 cortisols, progesterone, estradiol, testosterone, and DHEA. And the pro test, the advanced test, includes 2 additional tests. One is the thyroid stimulating hormone, which I have really good reference ranges on, and then the melatonin test. So there's 10 tests that are done with the basic test and 12 tests that are done with the pro tests. The cost is extremely reasonable. I don't know how long I can keep it like this because I'm really not making money, but it's okay because I'm getting phenomenal research. So if you buy 1 pro test, you're going to pay $156 for it, and including my program. It doesn't include the products, but it does include the program. And that's for the 12 tests. And you would resell that for around $240 or $230 or whatever you want to resell it for. And then the basic test is $140 each. It does not have the TSH or the melatonin. And that's $140 if you buy 3 of them. If you buy 1 of them, it's $150 each.
Do you have to prepay the test?
You have to prepay the tests.
Would you say about menstruating women, what day should they take the test?
All the instructions are there as far as what day the patient takes the test on the 2nd day of their cycle. If they're menstruating, if they're not menstruating, then I have specific results, which is how I run my research so that I can get everyone on an accurate way of doing it according to the moon. So I have a couple of different ways, but the instructions are very clear. Patients can understand it themselves. They take it home, they do it, they mail it in to the lab via UPS, and then the doctor gets the results in 10 days. It might go to 11 days sometimes it's 9 days, but it's an average of 10 days.
Thank you.
Any other questions for Teresa? Anyone else? Yes.
I think one of your recommendations for a supplement was mineral absorbate. Is that true?
Sometimes I recommend mixed mineral ascorbates to patients.
What's the source that you have for this?
The sorts are fruits and...
I mean, what company or...
Oh, I personally, there's a couple of companies. I like Pharmax as a company. There's a number of companies that I use, and a lot of them have good products, but it really depends on, when I give you the program back, you're going to have information. Then at that point, you can test the patient, and you can check the different products and see if you find something better for the patient.
Next, any other questions? Yes.
I have a question on the Meridian remedies that you talked about. Are these the Meridian remedies that originally came from Germany, or are these your own formulations?
These are my own formulations. And the Kern remedies, which are from Germany, are very low potency, and they're completely different formula. And so these are very high potency with low potency drainage remedies because I want them to go deep. For pregnant women, we can put it and deal with the emotional issues that the fetus might have because of the whatever, and we can put it right on the navel and it will go right to the fetus. We've had a lot of pregnant doctors in my NPR training where we did work with it. I've never seen a serious side effect, and and if the drainage usually works pretty quickly.
In the drainage remedies that you include are which ones?
In each formula, there
no, not
is.
the specific ones, but is there a company that you when you formulate them?
I get my drainage remedies that go into the neurophysical reprogramming. That go into the neuroemotional remedies. I get them from various pharmacies like Dolisos or various pharmacies.
Any other questions for Teresa? Yes.
Yes, on cavitations, have you worked with number 3s and 4s, and have you had success with your herbs?
Well, first of all, I don't use herbs. I use homeopathy. And the successes that I've seen with dental issues using homeopathy is very good, but it needs to be augmented with nutrition, minerals, vitamins. Minerals, of course, you're dealing with bone. You have to find out, and specifically get real accurate as to where it is, and to try to prevent surgery by using minerals, vitamins, possibly amino acids for tissues, CoQ10. There's many different things, and that depends on the patient. So I've seen very good success, but I've not used I can't tell you it's just one thing. Mm-hmm. I do everything that body needs. The body tells you. If you get out of your head, stop your mind from thinking too much, into your heart, test the patient with something accurate, you'll know just what that person needs.
Any other questions? Yes.
I'll let your opinion then everyone else's. Just on dental implants and titanium implants.
I probably am going to have a lot of people not like me here. But I don't like dental implants. I know that some of them that are made, the body adapts to pretty well. But I am not sure, because how long the dental implant will be okay and how much of a burden on the immune system. Will the immune system have to put its attention on that tooth instead of doing something else and going somewhere else? So I'm not 100% crazy about the idea of implants, but I'm certainly open to learning about new substances that may be where it may work for a long period of time. But there is the immune response relationship that I get very concerned about, because when I test implants, they always test as if it's burdening the immune system.
I'd like to answer that question. I did some of the initial implant research at USC on vitreous carbon implants. They all failed. Actually, when titanium first came out, when we did blood testing on there, it was one of the lowest immunoreactive, 4% immunoreactive in the population. I said it'd be a great dental material for inlays and crowns. Made 3 inlays and crowns, put in a patient. Fitted fine, took an electrogalvanic test, and I was shocked. I had the highest electronegative charge activity of any mineral I've ever seen. So I had to take these all out. One of the theories I have why implants are not rejected is because they produce a high electronegative charge which suppresses and sedates that energy line in the acupuncture meridian, so it puts it to sleep. Therefore, you're not going to get an immune challenge to it, which means it puts the organ system to sleep too. When I was with the Russian scientists on the Skaner group, I invited them down to Santa Monica to meet with them. We invited a lot of researchers and doctors to come meet with them, and I put on short notes. But there was one man in here who was one of the interesting researchers, and I got to look him up. He was from Orange County. He was representing about 4 major corporations in the Irvine, Orange County area. And we're sitting down having dinner, and we're talking. And I told him about a little bit. We were talking about titanium, and he did the research on titanium, and he said implants in the body, and he said it is so damaging to the body. He was the first person at a scientific level. I mean, we're practitioners up here, and maybe Bob's a scientist, but the first person at a scientific level to agree with me on the understanding of titanium. And I've had to take titanium implants out, and they are really they're the hardest thing. They fuse to the bone, and I mean I think it's like we're going to see in down line the effects of these implants. I'll give you one situation of a patient of mine who's a very famous rock and roll star and ended up with cancer. And it happened 6 months after a titanium implant went in, and we tested we got the components of the implant. We got the plastic components, the hip implant, and he was energetically reactive to that titanium implant. And it went right directly through liver gallbladder meridian here is where the cancer showed up, and that was right at the hip, liver, gallbladder area here. So I think you're going to see some major problems with implants. And Teresa's trying to apologize because we're dentists. We think we approve implants. This organization, I don't think, really doesn't approve implants that I know of. I know I spent 10 or 12 years trying to find the effects of root canals on the body. And implants, like I say, energetically, our German predecessor, Doctors Kramer and all, they said you cannot get a complete seal at the ligament, so you get bacterial invasion into the lymphatic system, and you also have what he says like a lightning rod into the body. Dietrich, you want to comment?
I'd just like to say something, because we have now also between Ara and I, we have maybe 15 years of experience and followed some patients with titanium implants, and I have to say the opposite, that our experience is that we had excellent experience with patients, and however there's some preconditions. We know the problem of electrogalvanism. When you have two different metals in the mouth, one is titanium and one is something else, you get high currents, you get a huge problem. And the one of the problems is the current technique. You have the titanium implant, you have a steel screw, and you have a gold bridge on top of it. You're messing up everything that is taught in dental school. And the second problem is that implants are placed in infected jawbone commonly.
That's a big.
And the third problem is that people are full of toxic metals throughout their body, so there's electric potentials and gradients between all these issues. And I started working with Don Bartram. Some of you know him here, like in 1989, and we were the first one in Australia to test out a system where the implant was out of titanium, the screw was out of the same batch of titanium, not just titanium, but the same batch of titanium, and the bridge work, the core of the bridge, was out of the same batch of titanium. And we followed these people now for 14 years, and they've done excellent health-wise. And so I'm holding the contrapoint that, and we know that the chewing ability of a good denture is about 10% of that of a natural jaw. That means you can't break the food down with plastic in your mouth. You can't get the nutrients to where they're being absorbed. So many people that have partial dentures and dentures end up with malnutrition and go down because of that. And I think we should weigh very carefully those different issues. When we have a patient who has had cancer, who has a high cancer risk based on either genetic profiling or P53 or whatever we're monitoring, this patient should definitely not have any root canal, any implant, anything like that in their mouth. If we have a healthy young person who's got a tooth knocked out in a basketball game, I personally know that it is 10 times better for the patient to have an implant than having a root canal. Let's not get that confused. Yeah, the root canal is not always, but almost always a deadly issue. The implant sometimes is a deadly issue, but believe me, I've seen people with bad implants. When we pull the implant out, the entire pain syndrome disappeared. Or as part of my cancer healing, all of the implants come out. There's no question about that. However, if you have a healthy person, and we check with my system, which is very good in predicting problems, we often find that under those conditions, no infected jawbone, the jawbone needs to be completely healed post-surgically, and that we minimize the number of other metals in the mouth and in the body first before we place the implant. Very often they're tolerated, and we're using the calcium-coated ones, so there is no direct contact between the immune system and the actual titanium, and we're having excellent results with that long term if we do all the other steps. So it modifies a little bit. I totally agree with what you said. In general, what you guys say is absolutely true, but there is a right way of doing the wrong thing, and it can turn out well.
Maybe we can bring this researcher out next year at the meeting. I'd love to have him come out, because this man had...
I'm sick of these researchers, because like Boyd Haley or these
No,
guys,
no, no,
these theoreticians that kind of come up with their theories based on some in vitro or animal experiments that do not apply to what we really see in life. I'm sorry, you know, I've just had to throw that in here because sometimes these guys, you know, in America now, the researchers have taken over medicine and are coming with their theories, telling us what to do, and so rarely does it apply to real life.
How about knee and hip implants, though? How about your reaction to people that have
Yeah,
knee
I'm an orthopedic physician, some of you know that, and so I have extensive experience with knee and hip implants. The moment you take the metals out of the mouth, the knee implant and the hip implant is not a problem anymore. And these are large surfaces of titanium exposed to the immune system. And they do beautiful. The moment you put one metal filling in the mouth or one metal crown in the mouth, you get a problem. Yeah? So there is a right way of doing it in orthopedics too. Yeah? The principle of electrogalvanism or of electrophysics applies no matter what your belief system is.
Right.
Yeah, and if you take care of that, you can handle a lot of issues with the modern technology. We don't want to throw out the child with the bathwater. You know, there is some good in all this, and the unfortunate thing is that we're not allowed to teach it that way. You know, I mean, so far cavitations didn't exist until the last few months, and we weren't allowed to talk about them. And root canals weren't a problem until now, and so now we are even, you know, acknowledging that there is a problem. Electrogalvanism was taught in dental schools 100 years ago, and none of the dentists that graduate now in dental school know anything more about it. The physics has changed in the medical schools. The physics, you know, it's like suddenly there is
The laws haven't changed, but
suddenly there is
physics
no suddenly the earth does not turn around the sun anymore in dentistry. You know, it has gone its own way.
I want to add one thing, not much on this thing. 72% of the failures, you know, on the implant post are because the dentist implanted it into infected bone. 72% of all the failures on implants are because they're implanted into infected bone. Our biggest market for our instrument is implantology. I don't like implants, and every one of the guys that buy my instrument, I tell them I don't like them, but I'm not going to say anything bad about them because sometimes that's all you've got. Okay, and let me tell you, if a dentist is not using the cavitat to look at that bone before, I can tell you an implantologist back here in the back, Roland Estabilo, what's your failure right now, Roland? It's pretty damn good, isn't it?
Very high.
Yeah, yeah. So, you know, it's he uses the cavitat before he puts an implant in, and the success rate goes way up. Now, it doesn't mean it won't get infected later. And go, yes.
I think people who have the right to talk about implants are the people who have done lots of implants.
Right, I agree.
Okay?
That's right.
I don't agree with having implants everywhere, but I've done hundreds of implants the last 25 years put by surgeons. You're right on about once we missed the cavitations, that's why they failed.
Right.
Now, I had I'm not going to mention his name, a physician that's written a book against implants. He came to my practice. He saw patients that were dying 20 years ago because they couldn't eat, malnutrition.
Oh, yeah.
The job, 25 years, this lady was 80 pounds. She's still living 20 years later, 30 pounds more.
Right.
This guy has written a book, big chapter, against implants. This man has implants in his mouth now, this physician. All right?
That's what I'm saying. I mean,
but you're right on. If you clean the jawbone properly, if you take care of what Dietrich said, you have to weigh things. There
That's
are
right.
millions of people out there with different
sometimes that's the only choice you
Now,
got. So.
To me, to this guy, structure is very important.
Right.
You give a person structure, you have to give away the biochemistry. You make him have a good lifestyle, etc., etc. But I personally, if I had to, I would never put a root canal in my mouth. But I don't want a denture either. I'll put implants out of hundreds I've seen in my practice out of 25 years, okay? But there are a lot of bad implants out there. So you just don't put implants. You have to clean the mouth properly, clean the health properly, get the oral hygiene right. I think that you guys should talk about periodontal disease. I think periodontal disease causes more problems than, of course, endodontics first, periodontal disease in the population. Not implants.
In the endodontic toxins and the periodontal toxins are the same. There are no difference in them. Okay, so this is what we're saying, and you're saying the same thing. Root canals are when you do a root canal on a patient, that patient starts to age at that point. I mean, that's the deal. And I'm talking about literally aging. Your hair starts turning gray, the muscles in the mouth start drooping because the toxins are killing the nerve. And an implant, like I say, 72%. Now, we've done surveys on this. We've been looking at them for 5 years, you know. And 72% of the failures can be attributed to the physician putting them into the bad bone. Okay, now period. That's it. I mean, there's no other qualification. Now we got 28% fail for other reasons. One is the electronic galvanization problem that interferes with other metals in the mouth, or the occlusal problem, the deal. But there's another reason for them to fail. Some of them are bacterial infections that have gotten in and traveled down around the spiral threads, and we show that up. It shows up as necrosis, as yellow with a cavitat at that time. And it hadn't got to a point where it's got a hole there, so it doesn't have any red, but it does show the yellow where the ischemia has developed and necrosis is spreading out from that root area of that deal. And I'm not hawking cavitat. In all my talks, I rarely mention cavitat because I don't think it should be in there, because I'm in the process of making money with the cavitat, although we about a $3 million loss so far, so I can't say it's a profitable organization. But anyway, it's like opening a dentist's office. The first year you're still wondering where all the money's going to come from. But anyway, it's a root canal is death. A implant may give the patient life if it's done properly and the bone is clean. But 80% of the doctors out there don't do it properly. That's where the problem comes in. And I still don't know whether or not you can say that they're 100% in what they do because of all the other effects they do, but sometimes that's the only choice a patient can do.
Dr. Monty, I'd like to ask Howard Remnick, the screen and electronic test you do, what is it that it really shows you?
Well, I have to find my man, Alan Seichi, who is with us. Dr. Seichi has incorporated that to measure the permeability of the cell as we are, and measuring the electromagnetic charge in the cell and the health of the cell. So when you measure, you try to find out the extent in which your cell is hydrated, because most of the problems we have is that the intra-cell.
These are total body cells, or?
No, all cells. Everything. All cells can be measured as to their hydration level, which is critical, because all disease, I believe, is that all the basis of disease and illness is the internal environment based on dehydration, toxicity, and an acidic environment. As we can control those three factors, I think you have your pulse on disease, or disease barrier. So that's what the machine measures.
Howard, did you want to make an announcement on
just one other thing, I very quickly. Dr. Lai and Dr. Ono were talking about probiotics, and they were talking about the different effects, especially on diet. As you all know, the Oriental diet is very heavily probiotic because of the way they process food. I'll just mention, we have an article that's going to be published in the next issue of Explore, the Professional. If some of you don't know that, it's an alternative medicine journal out of Arizona.